On this video, we'll be talking about prostate problems in young men. The prostate gland is a vital part of the male reproductive organs. In prepubescent boys, the prostate gland is only about the size of a grain of rice. By the time men reach the age of 20, the prostate is about the size of a walnut, and it grows slowly until the age of about 45. When a man reaches his mid-40s, hormonal changes cause the prostate gland to grow more rapidly, and this often leads to a common problem called benign prostatic hyperplasia or BPH. People do not think about prostate problems in young men because BPH almost always impacts males who have passed their 50th birthday. However, it is not impossible to find prostate problems in young men, and there is one condition that is particularly common in males who are under the age of 50. Prostatitis is the most common of all prostate problems in young men. Prostatitis is a swelling or inflammation of the prostate gland. The symptoms of prostatitis can include fever, flu-like symptoms, painful ejaculation and discomfort in the prostate or lower back area. The most common signs of prostatitis concern difficulty urinating. For instance, a young man with an inflamed prostate may find an increased urge to urinate combined with a feeling of being unable to completely empty the bladder. It may become somewhat painful to pass water and the urine may be tinged with blood. Although prostatitis is the most prevalent of all prostate problems in young men, medical experts are not always sure exactly what the cause is. Some cases of prostatitis are caused by bacteria while others are the result of a faulty autoimmune response. If a young man develops prostatitis, his doctor will need to screen him in order to ensure that he does not have prostate cancer. The treatment of prostatitis varies depending on what has caused it. Bacterial prostatitis can be easily treated with a course of antibiotics and analgesics. Non-bacterial prostatitis also requires pain medication and may also include changes in diet, warm baths and physical therapy. Cancer is one of the rarer prostate problems in young men. The majority of prostate cancer cases concern men who are older than 60. However, there are instances of prostate cancer in men who are younger than 50. What's more, research indicates that men who have a strain of human papillomavirus (HPV) are more likely to develop prostate cancer. The symptoms of prostate cancer are similar to those of BPH and prostatitis. That is why a doctor must always rule out prostate cancer when a man experiences those symptoms. To determine whether the prostate is cancerous, a biopsy will be required. This involves a small portion of the prostate being removed for analysis. Although prostate biopsy problems can potentially occur, the test is usually quite accurate when it comes to detecting the presence of cancer cells. Prostate problems in young men are not that common. Nevertheless, men of all ages should aim to avoid present or future prostate problems. All men should have regular prostate checkups once they reach the age of 40. Men of all ages should have regular prostate-specific antigen tests. This test measures levels of a substance called gamma-seminoprotein in the blood. This substance is present in higher levels if there are any cancerous prostate cells present. Visit our website for more info on prostate problems in young men at prostate.healthomni.com.